Hi, I'm Eileen, and this is another movement education video. And this is part 3 of shoulder pain and throwing. We started off in part 1. We kind of started from the ground up, and hopefully you've watched part 1 and part 2, and you've learned those other areas that are really important when it comes to shoulder function. I have repeated a couple of times now that you've got 18 muscles that can directly control the function of your shoulder, but the whole rest of your body indirectly controls the function of your shoulder. And by control, I mean can influence or impact both negative and positive. And you want to really understand that, because if all you're doing is using a TheraBand and just pulling out, right? A lot of people do this. I'm going to work my rotator cuff. I'm going to keep that elbow in against my side at 90-degree angle, and I'm going to pull out, and I'm going to resist what's going on, right? With that rotator cuff, the external rotator, you've got 4 muscles in the rotator cuff. Their job is not to be as strong as an ox. Their job is to keep that head of that bone stable in a really shallow cup. The glenoid fossa is very, very shallow, and the humeral head is kind of sitting in there. And the reason it's so shallow is because the shoulder is the most mobile joint in the body. It's got the most mobility. Your hip is the second most mobile joint, but I can't quite do with my leg what I can do with my arm, right? So because of that mobility, your rotator cuff is meant to keep it stable, kind of help keep it from popping out of that shallow cup. Those muscles aren't really meant to be really, really strong and doing all the physical tasks that all the other muscles are designed to do. And your muscles also are designed so that they eccentrically load once you initiate movement, which means they get longer under tension and they control the motion. So when I start moving this way, once I initiate the movement, guess what happens? All these muscles here are going to control that. They're getting longer, 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 and they're controlling that motion, right? Well, we talked about how important the foot and ankle is, and how everything is a chain reaction from the ground up. We talked about how important the hips were in part 2, and how they've got to have that ability to really rotate and frontal plane control and all that loading and unloading that happens there. Now we're going to talk about a third area that really intimately impacts shoulder, and that's your trunk, your thoracic spine, basically between your neck and your lumbar spine, right? The low back. So your lumbar spine doesn't really do a lot of rotation. It's really flexion extension. So your thoracic spine, it's kind of like Ginsu knives. It does it all. You really want it to be able to be fully mobile in all 3 planes so that your shoulder can do what it's supposed to do. Now, you may or may not be aware of this, but when you go to flex your shoulder, flexion is when that shoulder comes right up here. Now, I want you to look in the mirror at yourself when you go to do this full flexion of this shoulder, and I want you to notice where it comes up. Does it come up next to your ear? And I don't want you to come up like this and tilt your head and go, oh yeah, it touches my ear, right? You want your head to be upright, stay in midline, and see, if you bring this arm up to here and it comes out here, guess what? You've lost flexion. Now, it doesn't necessarily mean that the shoulder joint has lost flexion. It may mean that your thoracic spine has lost extension. Your thoracic spine needs to be able to extend in order for you to get those last few degrees of shoulder flexion. So I'm going to show you this, right? So I can come to here, and that's shoulder flexion. To get those last few degrees, my thoracic spine has to extend. So I can bring that arm all the way back and fully flex that shoulder joint. If my thoracic spine will not extend there, guess what? I'm not going to get full flexion of that shoulder. It's going to come out here. It might come to here if you're trying to keep it here, and you might be able to, you can't even push it back, right? God forbid you've worked with a movement professional, depending on what profession they're in, maybe even a physical therapist, and I'm a PT, so I know this stuff. And you might have a PT who's like, cranking on that shoulder when you're laying on your back on a table. We're going to get those last few degrees of flexion. But what if your thoracic spine won't extend in that area and you're trying to force the shoulder to do it? You're at risk of injury. Yeah, you're at risk of injury. People have been injured by healthcare professionals who don't have some of this knowledge. Now, I'm not necessarily blaming people or pointing fingers or judging or disrespecting professions. People can only teach what they know. They can't teach what they don't know, and they don't know what they don't know, right? So hopefully this is going to inform you a little bit about authentic human movement, and you're going to understand. So there's a lot of areas of the body that intimately impact the function of your shoulder. So if you've got pain when you're throwing, make sure your ankles are working right, make sure your hips are working right, and make sure your thoracic spine is working right. So I'm going to show you a couple of things that's going to help with the thoracic spine. Now, I'm not doing a whole big workout for the whole thoracic spine. I'm just going to show you some things that might help you get started. I believe I've got other videos that teach more about thoracic spine. So you want to make sure that the thoracic spine is moving in all three planes of motion. And so I'm going to show you a real basic, it's just kind of arm drivers. We're going to do all three planes of motion. So flexion is your thoracic spine flexing, right? Can you come all the way down and really get some nice flexion in there? And you want to see, and you don't necessarily need to bend at the hips. It's really the thoracic spine. And can you get your chin to your chest, and can you get a good flexion? Now, most people really struggle, and they're kind of stuck in flexion, right? Because of all this work we do sitting at desks and computers and on our phones, right? We're kind of stuck in flexion. So what happens with extension? Can you get a good extension, right? Can you get those shoulders all the way up and extend back? Can you do that? And yeah, I'm getting a little hip extension here and a little lumbar extension, because that's the strength of the lumbar spine, is to bend backward and forward. It really loves that motion. But can your thoracic spine do that? Can you get those shoulders all the way up, right? Can you get that up into that flexion? And then, of course, we've got side bending. We want to get that nice lateral flexion, is what it's called in the professional world. But you call it side bending. Can you do it, right? See if you can slide that hand down that leg. Can you do it? And if you want to add the shoulder involved, as long as your shoulders are okay with that, can you really get that beautiful opening up, side bending of that thoracic spine? Can you get it? And then rotation. Can you get rotation? Can you go all the way and point behind you to the right? Can you go all the way and point behind you to the left? And use your eyes. Have your eyes go where you're trying to go, because your body will follow where your eyes go. And so you'll get more rotation if you're turning your head with your body. I have taught some things about how to mobilize the neck from below. That's not what we're doing here, right? We're trying to get as much rotation as we can in the thoracic spine. So do that movement, really go for it. How far can I rotate right? How far can I rotate left? And if you've got a shoulder issue, don't stress that shoulder out, right? Just try to get as far as you can reaching. If you got to keep your arms down here because both your shoulders, God forbid, are a problem, then try to go as far as you can and really get that nice rotation. Now, when you're going for mobility, you want repetition, because it creates this beautiful pumping mechanism, this fluid fill effect in the muscles. It really helps to restore. If you've got one side that's really good and one side that's really not, then focus on the good side and see if it doesn't improve the side that's not really good, right? So really, if going this way feels really good, do this 10, 12, 15 times, and then see if it doesn't improve this way if this didn't feel good, right? But don't try to force something. If you're creating pain, Your body's trying to find a way to stop the pain, so your brain's trying to figure out what other body parts it can pull in to do the job you're asking it to do, so that it's not creating pain. So you're kind of training in dysfunction. You're gonna pull in the wrong pathways. You're not really improving anything. So if it really hurts going this way, but say you can do a little, then do what you can do. And you do that repetitively, and your body says, oh, that doesn't hurt. I don't have to do any protection. I don't have to, stop that. That's okay. We can do that for a long time. And you start to create this healing and repairing that goes on. And eventually you can go a little further, and you can go a little further. But ideally, if you start off on the side that feels good, and then come back to where you can go. Do the side that feels good as far as you can go, and back to where stopping before you feel pain. You'll be shocked at how much that helps. And if the other motions, right, the forward and the back are good, really focus on the motions that feel good, because you can train in other planes of motion to improve a plane of motion that isn't really good, and it will improve it. You want to access, and that thoracic spine, it's the silent saboteur. It doesn't complain. It doesn't give symptoms typically. Other areas complain because it's not working right. Your shoulders, your hips, your low back, your neck will all complain if your thoracic spine isn't working right, and your thoracic spine isn't saying a word. So it's really important that you understand how your body functions, right? So that you know what to do and you know what not to do. All right. I hope that you check out the Move Without Pain Private Club. There's a free class on there. You learn how to assess yourself in 3-plane function. There's a document you can download and document your findings. There's a whole free movement class on there with lots of great movements. And if you like it, you might just want to join the club. All right. I'll see you next time.